I wanted to call this meeting of the Health and Human Services Committee on the current situation that we have now with the Eastern Equine Encephalitis, Triple E, also West Nile virus. It's getting a lot of attention in the local press, the national press. And it seems like this situation is a little worse than it was last year. And I think we've had a fatality now in a different state. I think it was Vermont that someone passed away from the virus. And do we do testing constantly out here in Springfield for the mosquitoes? I know that East Long Meadow tested positive. I think it was for the West Nile virus.
Okay.
And but have we tested positive for any mosquitoes here in Springfield yet?
So as you know, across Massachusetts, the Department of Public Health puts mosquitoes traps in various places. We are not privy to where those traps are at, so they are random. And then the State Department of Public Health collects the traps and they test the mosquitoes to see if they have EEE or West Nile virus. Here in the city of Springfield, we have not been informed that we have a resident or that there have been significant mosquitoes that have been found in our area. Now, be clear, when the health department or the State Department speaks about Springfield, they broaden it to say Hampden County. And so usually they will not tell us which cities and towns, although the high-risk cities and towns do come out on a list so that we know who the high-risk cities and towns are in the Commonwealth. The Hampden County is at moderate risk, and so that means that that they have found mosquitoes in our area. However, the prevalence usually is more in the Berkshires and those places where mosquitoes more or less live because of the population that is in that rural areas.
Now, Helen, a question. Do you have any recommendations for the general public in Springfield to take precautions in case the virus may be here, but we just don't know? In other words, I think it was like, it's from 6 o'clock, from dusk to dawn. Try to wear mosquito-resistant sprays. If you're walking a baby in a crib, in a walker, try to put some netting around that child if it's after 6 o'clock. These are the things. And how about protecting your pets against the possibility of getting this virus?
Well, Counselor, you mentioned several that we are concerned about. So Eastern Equine Encephalitis, which, as you said, is EEE, and West Nile virus are here. They are in our community. Mosquitoes have been found in Hampden County, and so it's important for our residents to protect themselves. And so we know that using mosquito repellent with an EPA registered active ingredients is very important. Applying insect repellent when outdoors is very important. You mentioned dusk to dawn. That's when we know mosquitoes are the most active. So wearing long sleeve shirts, wearing long sleeve pants, even though it's uncomfortable. We are going into a very mild winter week this week. And so mosquitoes are still active. Mosquitoes are active until the first frost. And so we have at least a bit of a ways to go. We also know that in September, around September, we start to see less prevalence. For residents, look around your house, discard standing water. Make sure if you have pots or anything around your house where there is standing water, drain it, get rid of it, because mosquitoes breed in standing water. You talked about animals, really important. Also, making sure your screens, if you have your windows open, making sure your screens really do fit so that mosquitoes are not coming in. Here in the city of Springfield, we do not spray. We have not sprayed for mosquitoes in decades. What we do is put larvicide into the sewers. So we put a chemical in the sewers or in the drains that keep the mosquito population down. So we are actively trying to make sure we are controlling the mosquito population.
Helen, LeVar Glick, Councilor Glick has joined us. LeVar, how are you? LeVar is also the chairman of the Public Safety Committee, which this goes hand in hand. LeVar, would you like to say something?
Thank you, Chair. No, I don't necessarily want to say anything. I want to thank for a comment. Thank you, Chair, for holding this meeting, and thank you, Commissioner Paulson Harris, for all that you continue to do for our citizens. And I did receive a packet regarding some of the information as well at my home. But again, Helen, Commissioner Paulson, thank you for all that you do. Very appreciative, and any support that you need from any of the council, particularly myself. I'm here to support you, whatever endeavor you need me to support you at. Thank you again.
Thank you. Thank you, Councilor.
Thank you, Councilor Bruce. Helen, I want to ask you a question. What are the symptoms? What are the symptoms? In other words, how would I feel if I did contact it, or could I have it? And you can't spread it to other people, correct?
That's correct. But you know, what's challenging about West Nile and EEE is that many of the symptoms mimic some of the symptoms that we feel when we're not feeling well. A headache, being lethargic, you know, being unable to, on some levels, focus in some areas. And so we recommend that for all of those symptoms that our residents do take the opportunity to go online and look at these symptoms very specifically, because I'm not naming them all. And then, you know, again, if symptoms occur, go and see your primary care provider or go to a hospital. That's going to be very important. Again, we have been blessed, I believe, in Massachusetts as a whole. We've only had about 2 individuals, if I remember the data correctly, and it's not in front of me. We've had 2 individuals who have been impacted, and they have not been in the Western region. I'm just trying to see if my, I'm just trying to see if I have something here that tells me how many individuals. Yeah, it's not right in front of me, so I don't want to give out a number and be wrong, but you know, we've not had any deaths, let me say that.
Yeah, as of September 5th, Helen, we've had 7 cases of West Nile virus in Massachusetts as of the 5th of September. So there may be a few more added to that.
Thank you, Councilor. You're always so well informed, and I am grateful because I do not have those numbers in front of me. So thank you for that.
Commissioner Carlton, what is the most serious of the 2? There's one that there's no cure. Is that not correct?
Well, I don't think that, to my knowledge, that when you say cure, there is not, I don't believe there's a cure for either one if we're talking about cures. What there is once you get to the hospital with your symptoms, that the hospital is able to monitor and mitigate your symptoms. And so I'm not sure that cure is the right word, but there are ways in which hospital providers can mitigate the symptoms and get the individuals healthy. Because right now, again, although you stated we had 7, how many cases in Massachusetts?
7.
So none of those individuals have transitioned. And so what that means is that they were able to get to a healthcare provider or their primary care doctor and get some relief from their symptoms.
Helen, is this situation worse than it was last year?
Not to my knowledge. The year that was the worst, I believe, was 2020. And I believe in 2020, again, there were 286 cases in 2020, and that was the highest year that I can recall.
That's for Massachusetts.
That's for Massachusetts. That's correct.
Perfect. Any questions from Chairman LeVar Click Bruce?
No, again, no, thank you, Chair. No questions for me. I'm just taking notes and very informative information to bring back to the line. Thank you so much.
Thank you, Counselor.
So, Counselor Santinello, what I'm going to do is make sure that 286 is not just Matt, because it sounds like to me a lot for Matt. I do know that 2020 was the highest year, but 286 sounds like a lot for just the Commonwealth. So let me check on that for you and shoot you an email real quick, okay?
Yeah, I was looking at the long-range forecast for the month of September, and it looks like it's going to be extraordinary, a little higher than average for the temperature. What was actually a good thing was the amount of moisture that we weren't going to have. But now the Gulf Coast is about to get hit with a hurricane, and you know the way that moisture travels into New England after it's hit. So we've got to be on our guard to make sure there's no sitting pools of water where those mosquitoes can hatch and infect people.
Yeah, I think you bring up an excellent point that many people don't know, and I think you said it, is mosquitoes do lay eggs. And so that is how their population increases and usually lay those eggs in standing water. And so that's an excellent point.
Thank you so much. You've been terrific, as always. I'd like to thank you for being here and always reporting to us all the facts and being on top of everything. So
All
kudos,
right.
kudos
And
to you.
I'm going to check those, that 286 number. I know that's the number, but I don't recall whether it was Massachusetts or whether it was Hampden County wide or statewide. But thank you so much for doing this, because I think it's important. And if I would say any one thing to residents, I know you agree with me, is please check around your house. Get rid of that standing water that you might have around. You know, we haven't had much rain lately, but when we do, it can accumulate and it can cause the mosquito populations to populate. So thank you, Councilor Santinello.
Thank you, Helen. Any questions from the press? Okay.
All right.
With that, any other comments? That's it. Thank you so much for everyone attending, and I hope it was informative, and thanks for watching.
Have a great day. Take care.
Thank you.